like to thank the NFL Foundation for their generosity in making this course possible.
Hello, and thank you for joining me to discuss a critically important topic for healthcare providers. My name is Dr. Bryan. I'm a board-certified clinical psychologist who specializes in cognitive behavioral therapy, and I'm an Air Force veteran. While deployed, I was a clinical director of the Traumatic Brain Injury Clinic at the Air Force Theater Hospital in Balad, Iraq. Since leaving active duty in 2009, I've been researching suicidal behaviors and post-traumatic stress disorder in the military, and have been developing and testing the effectiveness of several assessment strategies and interventions designed to reduce suicide risk and prevent suicide. I am the Executive Director of the National Center for Veteran Studies at the University of Utah. I speak with you today in all these roles. My goal for this course is to provide you with some vital information about the best evidence-based assessment and treatment technique available today to help manage crisis situations with your military veteran patients. It's called the Crisis Response Plan, or CRP. This prevention and intervention strategy has been proven to save veteran lives. As clinicians, you are all acutely aware that suicide is a national public health crisis in America. The military and veteran populations, as well as their family members, have higher rates of suicide than their peers without military experience. Healthcare providers who care for our nation's military veterans should have a solid understanding of the risk and protective factors associated with suicide in this population so they can assess that risk and intervene appropriately. This information can save your veteran patients' lives, as well as those of their family members. As you know, suicide is complex. A number of researchers, including our team at the University of Utah, have been working to understand the factors that contribute to a person considering, planning for, attempting, and completing suicide. Most agree that it is really a combination of warning signs, risk factors, and protective factors that contributes to overall suicide risk. We believe that this combination has multiple levels, almost like a pyramid, which might help you to conceptualize the best way to assess for it. At the base of this pyramid, veterans who are at risk for suicide show underlying vulnerability or predispositions, which might include such long-standing traits as cognitive inflexibility or rigid thinking. They might also have a history of difficulty with regulating their emotions. In the next level, people at risk seem to have real deficits in some important skills that might have protected them. For instance, these veterans might have difficulty with anger management, problem solving, interpersonal interactions, or being able to tolerate feelings of stress or distress. At the top level are the symptoms which might be outwardly visible to those who care about the veteran or to you as their healthcare providers. These include depressed mood, hopelessness, anxiety, substance abuse, shame, anger, and suicidal ideation. All of these levels, of course, are related to the risk factors that many of us know, including a mental health diagnosis, family history of suicide, major life stressors, financial, legal, or relationship problems, social isolation, and substance use disorder. In addition, research has also taught us that there are factors in a veteran's life that will protect him or her from the risk of dying by suicide. These are just as important to know as risk factors. One of the most powerful is optimism. For many people, the ability to find positivity or hope in a situation is connected to finding a reason to live. Other protective factors include social connectedness, coping skills to be used when things get challenging, and access to mental health care. You can see the direct relationship of these protective factors to the levels of risk we discussed earlier. And they all lead to the development of the Crisis Response Plan. Our course in this series on intervention of the CRP will explain in detail how to develop a CRP with your veteran patient. However, as clinicians who may be treating veterans with suicidal thoughts or plans, you know how important it is to conduct a thorough assessment first. As part of this process, narrative assessment techniques, along with empathy and connectedness, will allow you to be able to clearly see the levels of risk facing your patient, as well as what he or she has in place for protection from that risk. With this information, providers are able to intervene more effectively to help save the person's life. Historically, providers have assessed patients in crisis through a traditional interview process, and if the person admits to suicidal ideation, they used what is known as a no-suicide contract. These contracts involve an agreement between the provider and the patient, in which the patient agrees not to attempt suicide before reaching out for help, and the provider agrees to be available or to help find other assistance for the patient. Although no suicide contracts have been used for a long time in clinical practice, there's limited evidence that they actually reduce suicide rates. In fact, a number of recent studies have argued that they might even cause harm, since they arguably add pressure to the patient and might make it look like the provider is only interested in limiting their own legal liability if anything should happen. As an alternative to this traditional approach, we believe that the narrative or story of the veteran's personal experience can be extremely helpful in assessing his or her risk, most importantly about intent to die by suicide, which some believe might be the most important factor. The benefits of narrative assessment of suicide risk include decreased complexity of the words you use, which ensures the patient really understands what you are asking. In addition, greater empathy and emotional connection to your patient. Narrative assessment is, in fact, the way that the crisis response plan is best completed, as a collaborative effort between you and your veteran patient based on his or her story. The crisis response plan is handwritten on an index card and empowers your patients to search for the factors that help protect them in times of crisis. The CRP has 5 sections. The first lists personal warning signs of crisis. The second details strategies for managing stress. The third names sources of social support. The fourth lists reasons for living. And the fifth includes emergency numbers. Each of these sections is best explored by the provider and patient together, using narrative assessment and allowing the patient to tell his or her story. For instance, to begin the assessment and introduce the CRP, you might ask the patient to describe his or her experience by saying, "Can you tell me the story of what happened?" As you hear the veteran's narrative, you can gather more information that might be helpful by asking about thoughts, feelings, physical sensations, or behaviors. Such as, what were you saying to yourself at that point? Once you have the story and have gained the trust of your veteran patient through hearing that story, each section of the CRP can be filled out using the same narrative assessment techniques. Please see our course on CRP intervention for specific tips on how to guide your veteran patient through each section on the card. One section we will spend a little time on here is the one that asks the patient to list reasons to live. Through narrative assessment, clinicians can not only help patients fill out this section, but in doing so can affect a number of both risk and protective factors. As we discussed earlier, cognitive inflexibility is often at the root of risk for many patients who feel suicidal. Their thoughts about themselves, the world, and the future are negative and feel stuck. Working through the process of finding a reason to live after all, when they might have not been able to see one at first, shows that their thoughts can change and be more flexible. Optimism is well established in the literature as a protective trait for those at risk for suicide. Specifically, our research has shown that establishing a reason to live on the CRP has been associated with increased optimism as well as reduced suicidal thinking and suicide attempts. Keeping in line with narrative assessment, when asking the patient to fill out this section, a provider might ask, "What gives you a sense of purpose or meaning in life?" Or, "What stands in the way of you killing yourself?" This section alone can greatly change the risk profile for your patient. Anyone can use the CRP. As healthcare providers, you are uniquely positioned to use this tool as part of your narrative assessment of risk and protective factors in your veteran patients in crisis. Unlike historical no-suicide contracts, The CRP is a collaborative effort between you and your patient, and unlike no suicide contracts, the evidence is compelling that the CRP actually reduces suicide. For detailed information on the CRP, what risk factors it targets, and tools for helping fill it out with your veteran patient, please see our course in this series entitled Crisis Response Plan for Healthcare Providers, Intervention. For more detailed information on studies that support the use of the CRP in veterans, please visit PsychArmor's healthcare provider course entitled Suicide in Military and Veteran Populations. References are also found in the resource list for this course. On behalf of my team at the University of Utah, our collaborators at PsychArmor, and your active duty military and veteran patients and their families, thank you for taking the time to understand how to assess suicide risk and protective factors with your patients, and how to translate that information to the crisis response plan. Thank you for taking the first step in being part of this evidence-based prevention and intervention strategy that has been proven to save veteran lives. And thank you for your outstanding care of our country's heroes.
The Veterans Crisis Line number is available 24 hours a day, 7 days a week. Please call 1-800-273-8255 and then press 1 if you or someone you know is in crisis or just wants to talk. If you have any questions or need assistance, go to the PsychArmor website or call the PsychArmor support line at 844-779-2427. Thank you for completing this course and taking that one step further in learning about our American veterans.